Okay, let's talk about pain during sex. Most people that come in with pain during sex come in after they've been to the doctors, and the doctors suggest some psychotherapy. I'm guessing because they feel like there's more at play than just the physical issues. So we dive right into the psychological issues, which is what I'm supposed to be doing. I don't like to mess around with anything else because I don't know what I'm talking about when it comes to is this happening because of anything biological or physical. And it's good to explain it this way. I like explaining what I'm doing with my clients. I'll tell them why I'm doing what I'm doing, and that seems to work really well. So it would be the same in this case. I would explain, listen, I'm just going to focus on what I can do, which is the psychology of it all. So it kind of removes us from having conversations, although totally up for listening to what a person is going through in their body, because it's completely correlated to what's going on in their mind. So what psychology could there be in a person that's having pain during sex? So let's say it's a female, because males and females feel it, but in different ways. So if it's a female, she's feeling pain during sex, I would try to understand right away what she's expecting, what she's fearing, what she's insecure about, so that we can understand all the psychological, emotional dynamics that are going on with pain during sex, and then try to address each one in order of importance. Somebody could say something like, yeah, I'm anxious, even a few days before I know I have to have sex, because I'm really scared that I'll feel pain, and I don't want to feel pain, and that's what I often feel. So it makes sense that I would be worried about feeling pain. And so if I'm anxious, my body's going to go right away, really tighten up. And if I'm worried about something, I'm just going to be constricted. So it's not the best approach with this, because if you already have a tendency to have pain during sex and then you squeeze your muscles, you're going to feel that pain more than if not. So right away, if part of the reason is that we're really tense and fearful of this act and we constrain ourselves, then the logical step would be, how do we remove that from that person? How do we make that a lot less so that that person doesn't have to be blocked by it? And then what do you do with that issue? This person's anxious and fearful. And I suggest to you, I don't know if I have time today to go into what my philosophy around addressing anxiety and fear, but you should probably get one. You should probably know exactly the best, most effective way for you to intervene on people feeling anxious and fearful. That is kind of our bread and butter. So there's so many different ways to do it. For me, what I often do is, work on all issues. How can we change the way this person is thinking about this in order to make it less scary or less loaded with meaning, for example? And then on the body level, how can we help people understand that what's going on in their bodies could be so connected to this fear and anxiety that they have in this area? Then, the emotional regulation when it comes to this, so what do I do when I feel anxious? How do I regulate that emotion so that it helps me move forward rather than keeps me or makes me move backwards? So emotional regulation, a lot of understanding between what you're feeling and your history, because then there's a lot of us have trauma or little T, big T in that spectrum. Most of us have some sort of trauma. And so if we don't know how to address trauma as therapists, if we don't have some sort of guideline for that, then we're going to be stuck with right there where, they can't move forward because they don't know what to do with the trauma. So you really need to bring some sort of perspective on how to work with trauma. So for the female, whatever approach you're going to use, the goal would be to reduce the anxiety and the fear that they have towards this act. And that a lot of times has to involve the partner, because a lot of times, unfortunately, the partner is what is instilling fear around all of this. In so many different ways. We haven't had, really good sex because she's always in pain. Hence, that translates to what's wrong with me and all the insecurities around, if I don't get this right, he's going to leave me. It's pretty intense. So if I'm feeling anxious and fearful for my partner's reaction, not only do I have to deal with my own fear, but I also have to deal with the fear of my partner reacting in a way that's really hurtful. So it's too much. So you have to work with both people in the relationship, and having one person really learn emotional regulation and wanting to do emotional regulation because they actually have bought into how they're contributing to this process. Because if they don't buy in and they feel like you're just making them do something that is uncomfortable, it's not going to be sustainable. And part of the conversations with the couple is like, let's change some of these expectations. So if the expectation is penetrative sex, no matter what, that is our metric, that is the goal. That is so much pressure, right? And especially where you're already having some difficulty, is it going to be effective to think of that as your ideal? Or would it be more effective and more true, actually, to think about like, if we have fun, then we've done a really good job, And so that also reduces the fear and the anxiety that person might feel, not only about what their partner does or what they feel, but also like, how am I perceived by others too? The other thing that could be going on, and I just mentioned it before, is trauma. Like there could be some trauma involved, and so that needs to be explored and worked with. But the worst of all of this is this person's already feeling broken. This person is already feeling like they're not enough, that they can't do this thing that's celebrated by the whole entire world as the best thing in the world, and that if you're not doing this, then there's something really wrong with you. So they're coming from that place. So anything more from the therapist in that regard, like shame, like in some way placing the reason why this is happening on this person's lack or insecurities or anything like that, because it's just too much. The last part of things to look at when we're talking about painful intercourse for women is having the couple decide that it's okay to stop when there's pain. Because a lot of people want to, feel the pain and just push your body more. And that doesn't really work, because your body starts, first of all, to become angry that it's being pushed to do this thing that is painful. And so it'll show up with things like, I'm going to give you some pain during sex, or I'm going to reduce your desire so you don't want to do this anymore, or you'll be getting sick more often, but all these different things. But the point being is like, I don't want to continue doing this thing that is painful. So the body doesn't really trust you. It doesn't really trust you to take care of it. And this step, your body develops some trust for you, because as soon as you feel like it's in pain, you're not going to say, you have to go forward and just, get through the pain to the other side. And I am fully aware that there are many people that are very successful with this style of encouraging people to grow. It's not really my style. I don't even know if it works, because I don't think I could do it, but it probably does. Anyway, I can only show you what I do, and this is what I do. So it has to be okay for sex or anything to stop when there's pain. And then, like if after a while, after like, it's been a good solid few years where things are going really well, then maybe, like if you get a little pain, you can say, okay, well, let me gauge where it's at. Do you think maybe I can just push it a little bit? Let's try a little bit, and then we can stop. That's not how it happens when you're full of pain and trauma and anxiety and worry. You're not having rational thoughts like that. You're having thoughts get really escalated really quickly. You're imagining the worst possible outcome. Your body is in like a state of agitation because it feels like it's in danger, so on and on. And so, yeah, you can push yourself. Everybody wants to push themselves a little bit, even through pain, but maybe from a place where you're not traumatized, or you're not super anxious or fearful. Wow. On the side of the men, when they have pain during sex, it's usually because they've reached a point, like they've been going on for too long, and they get hypersensitive. And that hypersensitivity feels like, like when somebody's like tickling you too much, like you can't take it anymore type thing. That's how they describe it. And a lot of times it has to do with the restriction that he has on having an orgasm. So he often can't have an orgasm and will spend a really long time having sex because he can't reach that orgasm. So his skin sensitivity obviously would become, would increase in that situation. And so the hypersensitivity and pain comes from that. So then we have to ask, like, okay, so why are they struggling with having an orgasm? And that opens up a whole bunch of stuff that could be going on, like anywhere from, I had a client that heard a whole bunch of young girls talking about like they had an experience and that person was a bad lover because he came too quickly. And so this little 12-year-old or 13-year-old decided that from now on, he's not going to come too quickly. He's really going to hold it in. And so after years of really practicing doing this, it became to a point like even if he did want to have an orgasm, he couldn't because he had been suppressing that for so long. So, and, you know, and then what do you do with that situation? You have a person that's been doing something for a very long time and has its own, and the reason that they're doing it is for insecurity of not belonging, insecurity of not being valued. And so you have to work on that to help that person. So that person comes to have more of a sense of value as far as like, this isn't, you know, the thing that's going to determine whether I'm valuable or not, whether I come too quickly or not. This is not a belief that I want to continue to engage in. So there you have to change value systems and identities and all of that. So that's one thing that can be going on. And then it could be connected to some abuse, where orgasm in some way is the marker of the abuse, or reframing from orgasm is liberation from the abuse. It could go either way, but the fact that those abusive experiences is influencing their present sexual experiences of like, I can't do this. And then, you know, the other aspect is like, the moment I have an orgasm, I have lost control, because when you orgasm, that is what happens for, you know, I don't know how long. You kind of have no control over that moment. So having somebody that is, I mean, really interested, I would say, or invested in control is going to have a hard time having an orgasm. And so how do you work with control with people? Like when they're highly controlling, well, control is a reaction to feeling out of control and feeling nervous and feeling fearful. And the way to get rid of those feelings is to have control. And so now you have to work on, again, the insecurities and the woundings that come from before. So it always goes back to emotional regulation and how the past is influencing that emotional regulation, and how to stay in the here and now with feelings and change the dynamics of how we cope with feelings and today. And most importantly, you know, releasing the shackles of shame that we have. You know, it's not like one, or, you know, it's like I'm not shackled just on my foot, I'm shackled on the other foot and my arms. You know, like there's a whole bunch of shackles that we have as far as shame. There's so many different ways we shame ourselves. Shame keeps you at best stuck, no movement forward, and at worst moving backwards. And so, you know, for me, I like things that work, that are effective. And so I'm not a fan of shame. I shouldn't be. That's stupid for me to even say that. I don't know why I said that. But yeah, I like going for shame right away, because it is the major way that we stop ourselves from doing what we want to be doing.